Hi everyone. Today I wanted to do a video kind of going over some of the recent data concerning COVID-19 and just kind of talk a little bit about what's going on and some things like that. So real quick, I am using the Johns Hopkins University Medicine website here because it shows a lot of, I think, easy to read and digest graphics. Easier than me just like sitting here and just saying numbers. And it's got a lot of stuff that you can dig into. So if you're interested, just go to whatever search bar, type in Johns Hopkins coronavirus map or coronavirus resource center, and you'll be able to find this pretty easily from there. Another thing, they get their data from the CDC, World Health Organization, state and national level, like departments of health, and similar types of governmental institutes and things. So yeah, it's pretty much, reliable scientific type data, things along those. So, we're going to start off here real general, what's going on within the world, and then I'm going to focus in a lot more on like what's happening in the US and so on and so forth. So right now we're seeing at about shy of 13.4 million total confirmed cases across the world. You can see this map here of the world. Each of the circles, the bigger the circle, the more cases. In places like the United States and China, and places that have like individual states, they've put the dots per state. Now, if you're looking at, say, here, the US, this looks like everything's laid out in a grid. In order to show the dots better, they kind of just centralized a dot to a specific area. So that's why it kind of looks this weird gridish fashion. But you can see definitely within the US, there are areas where there's bigger circles than others, which means confirmed cases there. Now, one of the things that I think is really bizarre, and this is why we call this a pandemic, is because of it's touched 188 countries around the world. But what's weird is when you look at like right here, here's this French Polynesia country that's got 62 confirmed cases. Over here in Fiji, there's 26. Falkland Islands, there's 13. You can see really quickly that this is touched pretty much everywhere. About the only place, I believe there's a few countries here in Africa that don't have cases. And there's somewhere else, but the only place that really truly hasn't hit is Antarctica. Yeah, there's a few little islands here and there. I don't know what this landmass is, so I don't know if there's not, but places that are pretty much isolated. There are people that live in Antarctica. There are parts of research teams. So there are people there. It's just that probably because they're so isolated and so restricted as to who can go there, that's probably why they haven't had cases. But yeah, you can just kind of see that it's spread everywhere pretty much. Other things, when we look at total cases compared by country, we know the US is sitting up here about 3.4 million. Brazil's at 1.9 million cases. And then you see this huge drop off into the kind of another bracket where India and Russia are in the high hundreds of thousands, 900,000 for India, 700, basically 750,000 for Russia. Then after that, you see another huge break. And then you get into the hundreds of like 300,000, 200,000, so on and so forth. And then once you get down a little lower, you start to get into tens of thousands and things. The other thing that's interesting to see is doesn't matter types of governments in country and things like that. And it doesn't seem to really make a difference as far as like your overall healthcare system. There seem to be other factors at play as to what causes this to spread and things like that. So again, all sorts of different types of layout. All these countries have different governments. They have different healthcare systems, all sorts of things like that. And you can just see how much difference there is between countries. Death-wise, fortunately, we're seeing at 580,000 worldwide. Really, unfortunately, we're seeing at basically 137,000. It's getting very close to that. But then we have this huge drop from U.S. deaths to deaths in Brazil at 74. And then again, another huge drop down to United Kingdom has 5,000. And you can see it just drops off pretty rapidly as you go down. Now, good silver lining is this set of data. Now, for whatever reason, I'm guessing it's probably too hard to do it by country. I don't know. I guess I shouldn't. I don't know. But this just focuses on the U.S. by states. This first number is the number of deaths. Then this green number is the number of total people who recovered. So you can see that even though 32,000 people have died in New York, double that have recovered. So that's a good indicator that majority of people are going to recover from the disease. It's just a matter of making sure that if they've had a more serious case, that they're able to have the right type of health care and stuff like that in order to recover, those types of things. Places like you see here in Illinois, it lists 7,400 deaths, but nothing recovered. It's probably because of some reporting type thing. I don't know specifically why, but I'm guessing there's some kind of reporting error or something like that in there that they can't get the data that they need for it. So they just aren't posting that. All right, so that's kind of a world view. So let's look at the US. So I'm just going to go to confirmed cases because I think it's easier to show. And over here you can look and see there's cases by county, deaths by county. I'm not going to go through counties by county because it's... And sorry, Alaska and Hawaii, but I can't get everything. So if we look here at this map, everywhere that's a lighter color, there have been fewer confirmed cases. Everywhere there's a reddish color, there have been more confirmed cases. And you can see some of the areas where we had the early confirmed cases, like up here in Washington, we had a lot of early confirmed cases. Here in Chicago, we had a lot of confirmed cases. The upper Northeast, particularly New York. But now we're seeing, as we've seen increases over the past week or so, in Texas, in Florida, throughout the South in general. Over here in the Southwest, we're seeing more cases. So these are hopping up fairly rapidly as far as confirmed cases go. And if we look at deaths, this is, again, kind of showing a heat map, if you will. The lighter colored areas have had fewer deaths or maybe even no deaths. And again, this is by county. The darker areas are where there have been more deaths. Now, my guess is, if we go back here to confirmed real quick, see how these areas are redder? When we look at somewhere like this area that's really red and this area where it's really red, go over here, we can see there's a lot of deaths in these areas. Same thing over here. My guess is because these confirmed case numbers are going up, we just haven't seen the death. Fortunately, we haven't seen the death toll going up yet because just confirmed cases have been going up. My guess is here in a week or so, we will see this area through here and down through here more so start to become. And unfortunately, that's probably a trend we'll see. Now, another thing, and I'm just picking on where I live because I live there. It is interesting to note, like, obviously Cook County, which is Chicago, had a high number of deaths and a lot of cases. But when we look at some of the other high death counties in Illinois, St. Clair's had a high percentage of deaths. I don't know anything about these counties really. I have some friends that live down in these counties, so but I don't know much outside of them. But you can see they've had pretty high death rates. Even the county in which I live in, we've had 15 deaths for 108 cases. While it's not a lot of deaths, that is for the number of cases. That's pretty high. So you can see it's just it's spread out weirdly as far as deaths go and things like that. But definitely where you see more confirmed cases is where you're going to see more deaths. So yeah. And then finally, I want to go over a few trends. So just a couple different trends here that I thought were kind of interesting that they showed. This is a truly I think this is a truly interesting, telling bit of data that they've put together here. And I'm going to walk through it because it's kind of complicated, because there's a lot going on. All right, so first off, you've got this dark yellow line here. Now, what this dark yellow line represents is the number of cases on a particular day, the average over a 7-day period. So, for example, at the point I'm at now, on June 16th, we can see down here, it says June 16th at the bottom now. Darn it. Actually, I'll fix it on here. All right, on June 30th, we've got 993 cases. That means over a 7-day period, around June 30th, the average number of cases per day was 993 cases. You can also see the cumulative total cases for Alabama on June 30th was 38,000. Now, the line is the 7-day average of cases. The bars, the lighter colored bars here, these are the total number of cases on a specific day. So on this particular day, July 9th, if we go all the way up here to the top of the bar, that tells us we'd have over 2,000, the way it looks like it's broken up, probably about 2,300, something like that, types of cases in one day. So the bars are the total number of cases in one day. Line shows the average number of cases over a period of time, so it kind of helps smooth out the bars a little bit. And then each of these dots up here represents something that the state of Alabama has done during the pandemic to, help or whatever. Red dots represent closings and restrictions being put into place. Green dots represent openings and like the removing of some restrictions. There's no blue dots on here, but a blue dot represents if the state decided to let counties make certain decisions on their own. And then gray dots just represent general things that don't relate to any of these other categories. It could be like funding for different organizations and things like that are put into place by the state. So I'm not going to go through every state. I'm just going to pick on a few states. I'm going to pick on Illinois because that's where I live. You can see here, we had obviously all the way back here in January 23rd, no cases. And then as we go through, we can see that we put in all our restrictions, started putting restrictions in March 12th and clicking on it. You can see here on March 12th, Governor Pritzker ordered the closure of public events of more than 1,000 people for 30 days. And then on the 13th, 2-week statewide school closure. Then more closures and so on and so forth. Real quick, let's click on one of these gray dots. So on March 25th, under the leadership of the governor, the Department of Commerce and Economic Opportunity launched Emergency Small Business Assistance Initiative, including the Hospitality Emergency Grant Program to support hospitality businesses during COVID-19, so on and so forth down the line. So that's what a gray dot means. Now, some people have pointed out that early on, even though we did all these closures and stuff, early on our numbers increased quite a bit, and they continued to increase here quite a bit. And that's just because you have to remember one of the more, insidious parts of this disease is the fact that most people don't show symptoms for 5 days. So if you get sick on, say, March 26th, there's a good chance you aren't going to show any symptoms until March 31st or later. But average so far seems to be around about 5 days. But during that time from March 26th, March 31st, any person you infect is also going to be asymptomatic for an average of 5 days. It means any person they come in contact with. So even though a lot of closures and stuff occurred early on, you still have a 2-week span here in which people were still going to be getting sick because of their interactions with people previously before. And so that's why you see it go up. Then we had some removings of restrictions, things like you could go to restaurants to get food, carry out, things like that. And we still see case numbers going up. I don't know what happened on this particular day to cause such a decrease, but you can see just a couple days later, we had this huge increase. And that's why this line's here, is to kind of level that out, kind of give you a better indication. But another interesting thing is basically at this point here, the state has reopened as entirely as it can reopen. You know, there's still limitations on group size and things like that. But a lot of restrictions have been pulled away at this point. And a big reason that decision was made is because, as you can see, we've kind of gone over the hill and our numbers have been in decline. Now we're seeing an increase here. It remains to be seen if this is a total increase over time or just a little blip in the system. But we'll see. Another state I'm going to pick on is Florida, because they've been in the news a lot lately because their case numbers are going up, unfortunately. And you can see here, they have gone up since about June, since about June 10th, it looks like. They've been starting to go up almost exponentially, which is not the kind of thing you want to see in a pandemic. You want to see not such high growth. Now, it is interesting to see that they definitely had a fairly long period of pretty steady to low numbers of cases per day. Again, these are cases per day. This does not, there are cumulative cases here, but the 629 means that they added 629 cases. The average they added in was 629 cases on that particular day. The next day, here's 780. The next day they added an average of 1,700 cases. So these are the additions to each day. So you can just see how it's growing and growing and growing and just rapidly increasing. But they had removed most of their restrictions in this time period. We see now that because of this exponential growth rate, this rapid growth, they have shut down bars to try and help limit some of those things. Another place that's had a lot of cases but seems to be on the mend, so to speak, is Arizona. Again, they had this period of very low cases per day. Then they had this huge, more or less, I looked at this earlier, that's why I'm not clicking on it right now. More or less, these are openers of things like bars, restaurants, larger groups, things along those lines. Their numbers started to grow. The state took the action of trying to allow counties to make decisions at the county level as to what they felt was most appropriate. The numbers still kept going up very rapidly. So they ended up putting in things like, again, reducing group numbers and make sure you're increasing social distancing and things. And it looks like they're getting around the curve here, so to speak. So the trend looks like they're either going to be leveling out and then a decrease, or maybe they've hit their peak and they'll decrease again. So that's a good indicator for them. Finally, picking on Texas, because unfortunately they're another state that's been experiencing large. You can see again, yes, early on they had low numbers of cases per day, and probably that's what drove, to some degree, hopefully that's what drove their government to decide to reopen the way they did. But then they had this huge increase, and they've had to go through a whole bunch of different types of restrictions and type thing in order to try and get this under control. And again, this little bloop here shows that the numbers are going down, but we don't know if that's just a little blip or if that's going to show a continuous decrease. Hopefully it's going to show a continuous. So anyways, I just thought those were some interesting points of data. I would highly recommend, particularly if you're watching this from a state that I didn't cover, so maybe you live in Missouri, and you kind of want to look over this stuff, you can, again, just go to their website, look it up, and you can look over. They have tons and tons of different graphics and things like that. They have, graph that shows how daily confirmed cases look in different countries, even break it down specifically by country, things like that. So lots of stuff here that you could digest if you're really into this and really want to know a lot more. But thought maybe just kind of sharing some of this information, kind of pointing it out, might help some people kind of get an idea of how scientists to look at this information, how health departments look at this type of information, how different governments are looking at this information to make decisions. and try to come up with the best way to reopen, the safest way possible. So, I hope you found it interesting. Let me know. Subscribe if you like what you're seeing, and I will talk to everyone later. Thank you. Bye.